The names joining in on Zoom that are very familiar to myself and to our friends at TENS Care. So thank you for joining us. It's also very nice to see actually some unfamiliar names joining us. And I'm not sure, I can hear somebody's microphone on in the background. I don't know if that can be just muted for now. But it's nice to sort of see some unfamiliar faces as well. And I hope that over the next hour and a half, you get to know us a little bit better, get to know a little bit more about TENS Care. And I'm very proud to be the managing director of TENS Care. My name's Neil Wright, and I thought I might just start this webinar by just saying a little bit of background about TENS Care. TENS Care are 28 years old this year, and we have a long history of developing electrotherapy products that are ailment and condition specific muscle rehabilitation or pain relief management products. And way back at the start, 28 years ago, we established the market in maternity TENS pain relief. So providing a TENS unit that was specific for mums during childbirth to relieve the pain of labour pains. And since that inception, we have developed a number of products over the years that have been very targeted to a specific ailment. And that includes things like the electrode gloves for arthritic pain, socks for diabetic neuropathy, pelvic floor exercises for muscle rehabilitation to help with continence, the OVA product that targets pain relief from dysmenorrhea and endometriosis. And in that vein of product development, our product development team have come up with the Mynd product, which is a anti-migraine product. And I'm really so proud of what our product development team have done. Some of them are here on the screen today. And what they've done is they've taken our expertise, they've seen a market need that actually is very often poorly diagnosed, very often poorly medicated, and they've applied our technology to come up with a solution. And what I really like about what they've done is it's very much aligned with our TENS Care mission to improve the quality of people's lives. So it's a product that's got a real purpose to it, and it's very much aligned with what we're about. So I thank them for that vision. And you know, in life, leadership is about, I think it'd be fair to say that we'd accept that vision and communication are two great attributes of leadership. And so I'm really pleased with what they've done, and I hope that we can communicate well what they have done in the next hour and a half. And the thing with communication is the real skill to it is listening. So I want to thank you for all being here and listening for the next hour and a half. Coming up, what we've got in the next hour is I'm going to hand over from here down to David, my colleague in New Zealand, who is going to talk us through what a migraine is. And then we'll come back up to London, so to speak, and we'll hear from Mackenzie, who will be explaining some marketplace statistics and the scope of the marketplace. And then we'll introduce you to Professor Tim Watson. And Tim Watson is not a TENS Care employee, he's very much independent, but he's also very much an authority, a global authority, I would say, on electrotherapy. And if ever there was a way of time traveling, listening to Tim Watson would be a way of time traveling, because he has got a lifetime's worth of experience that he condenses down into 30 and 40-minute presentations, and it will save you hours and hours of research by listening into what he's got to say. So I hope that you really enjoy his session as well. He will be staying with us for questions and answers afterwards as well, so feel free. But also check out his website as well, which is a real treasure trove of clinical information and evidence. And for us as a business, we let ourselves be evidence driven and clinical evaluation driven research that we have. I suppose to coin a phrase, actually, what seems to be a politician's phrase is we'll be guided by the science, and as a business we're very much guided by the science. So I hope that you enjoy his presentation. After Tim has spoken, we will hear from Hanwei and Karina, who will talk us through the actual product, the Mynd product, and then there'll be a short demonstration of the product by Connor. So what I want to say to you is thanks very much for giving us your time. I hope that, you know, what you hear, you're going to learn something new, whether you're here for commercial reasons, thinking, well, this could be a product that I could sell into my healthcare practitioners or into pharmacies, or whether you're here for clinical reasons because you are a healthcare practitioner or maybe even perhaps a sufferer of migraine. I hope that you'll find something useful to take away with you in the next hour and a half. I think there is a bit of a comfort break part way through, but I'll let Lisa facilitate things there. So without further ado, in good outside broadcasting parlance, I will pass over to the work from home studio down in New Zealand and hand over to David Maxwell. Thanks for joining us. Thank you.
Thank you very much, Neil. Unfortunately, as it happens with technology, we are experiencing a bit of a technical issue with the New Zealand studio. So David is trying to rejoin us, and if you give us 1 or 2 minutes until he joins us back, and I will send you all to the attendees room where you can sort of view and listen to the rest of the presentation, if that's all right. So 1 or 2 minutes for him to join, and I'll do the technical bit as well on the backside. Thank you.
Great. Okay. Just while we're waiting on for David to join us, I'm just going to sort of skim through the list and maybe do some introductions of who's here. It's nice to see you, Dorrit, joining us from a sunny Israel. And I think Manolo, I think I can see a picture of you, but I can't actually see you. But I dare say, I don't know what the weather's like in Spain. I suspect you've had some bad weather recently, actually. But yeah, nice to have you here with us. Yeah.
Has been horrible, the weather here in Spain.
Yeah, I think I sort of saw some of that on the news. It's not typically Spanish weather, I don't think.
It was like in Canada. Something like that.
Yeah. Yeah.
1 meter, 1 meter.
Oh yes, yeah. I think I saw that on the news. Yeah, big heavy snowfalls.
And 2 days ago has been like London, all raining, but I think it's the COVID that is becoming crazy, everybody. So
yeah,
that is nice.
This is what we do when we have a technical hitch. We talk about the weather. It's a very English thing to do. Yeah. So if David can't join us, maybe what we might have to do is move to Mackenzie to talk about statistics, and then have David talk to us about what a migraine is. I don't know how easy that is to shuffle the slides around, Lisa, if you want to say what you think.
Yeah, no, I just need 1 minute. I think he's joining. It will all work well. Just 1 or 2 minutes. If that doesn't obviously work, then yes, we'll make adjustments. I do apologize for that. We've done a rehearsal, all worked well, but when it comes to the real event, it always
seem to have lost some people as well.
Now they're already going. I'm sending everyone to the to avoid any unnecessary background noise. I'm just sending everyone to the kind of visitors room.
Oh, I see. All right. Okay. All right. Okay. We'll see you in the visitors room then, in the green room. Nice to see you, Snezana, as well. Snezana's just gone.
They all can hear. They just there's no sound from the visitors point.
Okay.
Oh, good. I think.
Okay. I'll mute myself and let David crack on. We've got Ivan Smith-Olnitz in the room with us.
I think it's, I cannot see. Dude.
I think let's roll with Mackenzie then.
Yeah, we should probably just get to the conditions of.
Would you like me to?
Hanway, do you want to give it a go? You said.
I've got David's script if I can try and talk through his slides best as possible.
Yeah, let's do it this way.
All right, cool.
Hopefully David will join and take over. Morning everyone, I hope you can all hear me. I'm going to try and do my best David impression this morning and give you a brief introduction on the condition of migraine. So just the sources of information that this presentation has taken can be seen on the screen. A variety of resources that we've kind of researched to talk about the problem today. So basically, the first thing to understand is that headaches are not all the same. Headaches can be divided into primary and secondary headaches. Headaches are then deemed acute or episodic if the sufferer has pain for up to 14 days a month, or chronic if it's in excess of 15 days a month in any 3-month period. And I believe that may be it from me, and we can hand over to David.
Oh, apologies everyone for that. Technical issues. I'll try and
I'll you off, David, but you can take over if you're it's all working now.
Sure, yeah. So we're on to the slide about the primary and secondary headaches, yeah?
Yep.
Okay.
I think we've lost David.
Yeah, I think he's frozen, right?
Yeah.
Okay.
Sorry, guys. That's the world of Zoom that we seem to be living in this year. Well, let's hand it back to Hanway to push on through.
So yeah. So we have the acute or chronic, which I've just described. So acute is for up to 14 days a month, but if it's over 14 days, so it's 15 days a month in any 3-month period, it is deemed as a chronic migraine. Primary headaches can then be further subdivided into tension, migraine, and cluster headaches. Secondary headaches are usually more sinister as they're associated with underlying disorders and include headaches associated with medication overuse, giant cell arthritis, counterintuitively, medication overuse headache commonly occurs in those taking medication for a primary headache disorder. So we're going to just look at briefly the different types of headache. So we have tension headache. The location of the pain in the tension headache is typically bilateral, so it's essentially both sides of the head. The pain is usually mild to moderate, and it's not aggravated by routine activities of daily living. Tension headache, probably most common cause of headache and a generalized headache, so there's no associated symptoms like nausea. So a cluster headache is the next type of headache, and this pain in a cluster headache is unilateral, so it's around the eye, above the eye, and along the side of the head or face. The pain quality is variable. So what this basically means is it can change. It can be sharp, boring, burning, throbbing, or also tightening. And the pain intensity is described as very severe, so worse than a tension headache in the sensation. And then the next headache that we're going to discuss, and the one that we're all interested in with this product, is the migraine. So again, the location of pain on a migraine is unilateral, and it's described as pulsating. I'm sure if any of you have had a migraine, you don't need me to tell you how it feels. but the intensity of the pain is usually moderate or severe and can be aggravated by a number of things, such as routine activities of your daily living, so just your day-to-day life, unusual sensitivity to light or sound, and also other symptoms can include nausea, tingling, numbness, and visual disorders. So as you can see, it's a real problem for a lot of people that can really affect their quality of life. Often migraine sufferers will wake up with a headache, and they can have a headache all day long. So this, and you see on the screen here just some of the triggers that can cause a migraine. So we've got lack of sleep, lack of sleep, stress and anxiety, caffeine, skipped meals, and physical exertion. And this slide is just showing that the global statistics. Macca's going to go into more detail later about this, but how much of a problem migraine is around the world. Migraine is ranked globally by the World Health Organization in people under the age of 50 as the single most disabling medical condition in the world, and the leading cause of disability among all neurological diseases. As I said, Macca's going to go into more detail on the actual spread over the world and statistics. So looking into basically what is a migraine, and there are 4 different types and stages through which a migraine can progress. So the first stage of a migraine is the prodrome, which will last up to from a few hours to a few days. And this is the warning phase. So you will essentially experience things such as food cravings, irritability, yawning, depression, difficulty sleeping, nausea. All of these are kind of the warning signs that a migraine is underway. The second phase is the aura. This is a phase of neurological dysfunction, and it's typically just before the headache. So with an aura, people can have a sensory aura, like a tingle or a numbness that will spread through the body. Again, this is a sign of this aura stage. People may also have a motor aura affecting the muscles, which can essentially lead to difficulty in speaking. The third stage of a migraine is the attack. So this is where the pain is felt. And then we lead to the 4th and final stage, which is the postdrome phase. Around 20% suffer of migraine. People who suffer from migraine suffer this phase, and it can go on for up to 2 to 3 days. So if you look at the whole duration of that migraine, it's a very long period of time. The postdrome is often described as a migraine hangover, where the sufferer can feel tired, depressed, and find it hard to concentrate. So trying to understand what causes a migraine, and essentially the cause of a migraine is not fully understood. There basically is no known cause for migraine, and almost all people with it are genetically predisposed to migraine. So essentially it's in your genes. If you are susceptible, sorry, Macca. If you are susceptible to migraines, there are certain triggers. We did touch on this earlier, but common triggers can include atmospheric pressure, lack of sleep. Certain aromas apparently can cause a migraine, although this is not considered to be common. Hormonal changes in women, and also your environments. And then just looking at treating migraines and how the current ways that we can do this. Obviously, we're hoping to introduce a new product today that can tackle migraine in a different way, but commonly migraines at the moment are treated through use of pharmaceutical drugs, and there are a number of options available. Again, I'm sure people that suffer from migraine, if there's any here today, will have experienced using some of these. I'm not going to go through each one, but yeah, these are the current pharmaceutical methods that we can treat a migraine. I believe I can now hand over to Mackenzie, I think. Mackenzie's going to talk through the basically the worldwide statistics and show us why migraine is a problem for many people all over the world.
Thank you. Thanks, Hanwe. So hello everyone. This is the first time that I will have met a lot of you, so it's a pleasure to meet you. I'll just give a brief introduction to who I am. I'm Mackenzie, and I work as a part of the e-commerce team at Tenscare, managing several online platforms, namely Amazon Germany and our eBay accounts. So without further ado, let's get to it. So to begin with, I've got the worldwide stats, and I feel like this gives a good perspective on the globe and the prevalence of migraines across the world. So the graph that we have here shows that the prevalence of migraines per 100,000 population per the location for both sexes in 2016. And the darker reds show the countries where it is more prevalent, and the darker blues where it's lesser prevalent. It might be worth pointing out that the darker blue region of China is not necessarily due to the fact that they have less migraines, but actually that there was little data available there. But I think this is really interesting, as it sort of shows the full scope of the health condition and how it affects everyone across the world. Right now, currently 21 million people will be experiencing a migraine. So an alternative pain relief solution such as the Mynd would definitely be warmly welcomed by a lot of sufferers. Moving on, if we look at the United Kingdom, so when developing the Mynd, our own domestic market was at the core of our research to help us understand the scale of the disease and who it was affecting, and how we could innovate an affordable and effective solution for the sufferers. Research shows that migraines are the third most common disease in the world, with around 190,000 attacks every day in the UK alone. 1 in 7 people in the UK are affected by migraines. It's not just a severe burden on a person's quality of life, but it is also a significant strain on countries' health services and economies. It's estimated that the NHS spends around £150 million a year treating migraines. Now, whilst improving the quality of life for our users is at the heart and the core of the Mynd, being able to feed into a wider healthcare system and reduce any strain on our National Health Service is something that we would be incredibly proud to do, and a social responsibility of ours. So looking now at Europe, so I've broken Europe down into a few different countries. Unfortunately, I haven't got time to go through them all, but I'll just start by looking at this region here. We can see that 14% of Europe's populations are affected by migraines, as well as it costing £50 billion a year to the region. So as I said, I'll just break it down into some statistics for individual countries. Looking at Germany, there's a very interesting finding from a study conducted by Raduct in 2008, and it found that half of migraineurs treat their migraine exclusively with over-the-counter drugs. And given the results of their investigation, it was concluded that a great proportion of migraine patients in Germany remain suboptimally treated. Now, what I found interesting was that this is not something just limited to Germany, and it is a reoccurring theme amongst a lot of research and international studies. And this highlights the opportunity in the market for an alternative migraine relief. And we believe that has been innovated in the Mynd. Looking at Spain, the point here relates quite closely to what I've just mentioned, but around 35% of patients overuse simple analgesics. This leads to medication overuse headaches, otherwise known as rebound headaches from taking medication. This is a side effect that is not as prevalent in the Mynd, and in terms of general side effects, they are much less in the Mynd than you might experience using pharmaceutical drugs, especially stronger prescription-based painkillers. In Poland, a really recent study in 2019 concluded that there was a strong correlation between migraines and a major impact on the quality of people's lives. So I think it's important when we look at the Mynd not to just understand that it's to provide initial relief for the user, but actually there's an upside potential for the long-term benefits to the patient to allow them to live a healthier and a happier life. Moving across to the other side of the world here. Oh, sorry, I've actually missed Denmark. I'll just mention that point about Denmark because it's quite interesting as well. The data in Denmark suggests that there's an increase of 9.1% in the lifetime prevalence of migraines. The reason for this could be our increased awareness of migraines as a disease. But I think this is really relevant given the current climate. Stress at work and home are leading causes of migraines. Currently, with the current climate of the world and COVID, there's been a real blurred line between work and home life, with a lot of people now working from home, and also an increased screen time, given that we're limited in social activities that we can do. And digital eye strain is likely to trigger many migraine sufferers. So I do think it's very current as well. So back to Australasia. In Australia, 3 million people suffer from migraines, as well as it being shown that other health conditions such as stroke and anxiety disorder are higher among people with a migraine. In New Zealand, around 1 in 10 suffer from migraines. Around 40% will experience an aura, which Hanway briefly mentioned earlier, with those between 10 and 30 experiencing the most severe headache. So the Mynd has 2 tailored programs for preventative measures and for pain relief during an actual migraine. Many drug-based migraine reliefs focus purely on pain relief whilst experiencing the migraine, rather than a preventative measure, as the Mynd does. I've got some statistics here as well from the Middle East. We'll look at Israel. As we saw, it was 1 in 10 in New Zealand. It's 1 in 8 people that suffer in Israel from migraines. And in general, for the region, migraines are seen mostly in women aged 18 to 44, with recorded patients being 93,437,442. I think this just shows the scope. That was from the 1990 to 2016, and how big a problem this is and how many people it really does affect. Lastly, we'll look at Latin America. So the findings in Latin America show that actually the prevalence in Central and South America of migraines is significantly higher than the overall global prevalence. Resource use associated with migraines is high, with Latin American patients significantly more emergency room visits and hospitalizations compared with patients from North America. Just to sort of tie my bit up, really, we've looked at the statistics, and I thought it would be good to just look at some market analysis in comparison of competitors, that being pharmaceutical drugs against the Mynd. So I've got a table here, and you can see some limitations and benefits of both. To begin with, something that I have mentioned earlier, but I'll just mention it again, is the medication overuse headaches. So this is prevalent for approximately 58.5 million people, with estimates of 32% of chronic migraines sufferers experiencing it. There's limitations to drugs. For example, triptans, which are a type of medical migraine medication, do not provide preventative treatment, and they cannot actually be used by everyone either. And lastly, it would be the side effects. Common side effects include sleepiness, tingling, tightness of chest, and nausea. Patients can also develop a strong tolerance to these drugs and even become addicted in certain cases with, especially opioid-based drugs. With the Mynd, we have a completely different type of pain relief here. It's got the 2 tailored programs to prevent and pain relief during. It's a very simple to use device. It's built to last, and it's also affordable. And there's no risk of addiction or medication overuse headaches. And just to conclude, I think there's 3 main points that really should be taken from this section. The first is that migraine is a condition and a disease that impacts people across the globe. It's not limited to one corner. Everyone in the world can experience this, of any age and of any gender, and it's a significant burden to their quality of life. The majority of research concludes that sufferers are being inadequately treated. And looking at the consumer behavior or patient behavior, it is showing that there is a reluctance to take strong prescription-based drugs with most people using over-the-counter drugs. Therefore, there is a really big opportunity for an alternative solution, a pain relief solution, and the Mynd itself presents itself as a strong fit for that consumer choice. So thank you for listening to my section. I'll pass you back now to Lisa, who I believe will update you on the rest of the agenda for today's presentation. Thanks.
Great. Thank you very much, everyone. Thank you very much, Neil, Hanway, for rescuing us as well, very unexpectedly. Mackenzie as well for your presentation. I can see that Professor Tim Watson already joined us, so we'll just have a bit of a sanitary break, 5 minutes, whilst we set up Mr. Watson on the presentation. If anyone needs to go and make themselves a cup of tea, a cup of coffee, or just a glass of water, please do so now, and we'll meet at 10:45 when Professor Tim Watson will start and present his part of the event. Thank you very much. I know you can all hear us. We don't hear you, but it's a 5-minute break until 10:45. We'll see you shortly. Thank you. Hello.
Hi, good morning, Tim.
Good morning, team.
Good morning, all.
Hi.
All good?
Was that Neil I saw down the list? Hello, Neil.
Yeah, I'm on the little panel as well. I don't know how I managed to get myself into the panels. I described you earlier, Tim, as like being with Doctor Who. Yeah,
is that right?
I was saying it's like, I said for the listeners, it's like being a time traveler, in that you've got a lifetime's worth of experience that you condense down into these 30 and 40-minute chunks and save people hours and hours of research. So if someone calls you Doctor Who,
you bigged it up nicely. Thank you.
So no pressure whatsoever. Yeah,
none at all.
Good.
None at all. All right.
Marco, do you mind if I put you?
Yeah, no worries. Would you like me to stop sharing the screen so Tim can?
Yes, please. Tim, you can now put up your PowerPoint and just sort of put that into the full presentation. If Neil, do you want me to put you into attendees, or you'd rather stay here?
I'm happy to go off into the other room, actually, if that works for you. You can.
No, it's up to you. It's just.
No, kick me out of the panel room. No, actually, leave me in the panel room in case I need to say anything to
All right.
You can do what you like.
Yeah, but I'm going to go and get myself a cup of tea while Tim gets himself.
Sure.
I will also get a drink. Actually.
All right.
Okay. See you in 2 minutes.
Yep.
Morning, Henry.
Tim, how are you today?
Yeah, I'm okay. Thank you. I'm okay. Right. Do you want me to try the screen share,
Yes, please.
Lisa, just to make sure it works?
Yep.
All right. Okay. Let's do one of those.